Mulai dari titik, Dr. Adib.
Ya, oke.
Mulai. Okay, good afternoon, good evening, honorable
Freeze, jadi freeze.
Yeah, she seems to be frozen.
Ya, izin saya Dr. Titi.
a speaker, Dr. Otmar Kloiber.
Ya, izin Dr. Titi saya buka, nanti saya akan sampaikan dalam dua bahasa. Langsung diserahkan ke moderator ya.
Okay, so this evening we will be moderated by myself as well as Dr. Jul Asdi. And maybe before we start, I would like to invite Dr. Muhammad Adib Kumaidi to give opening speech. Time is yours, Dr. Adib.
I think it's firstly from the Dr. Jul Asdi first.
Okay.
After the Dr. Jul Asdi, that's I.
All right.
Ya.
Okay, please, Dr. Jul Asdi.
Ya. Terima kasih. Selamat malam. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Especially for Dr. Otmar Kloiber. Thank you. Kita akan bicara dalam dua bahasa. Jadi saya akan ngasih pengantar dalam bahasa Indonesia, lalu nanti dibantu sama Dr. Raisa Rizky Amanda dalam bahasa Inggris. Lalu Dr. Titi nanti akan memandu kita dalam dua bahasa. Mohon kesediaan Ketua Ikatan Dokter Indonesia, Dr. Muhammad Adib Kumaidi untuk membuka acara.
Thank you. Good afternoon, good evening. Thanks for the Otmar, the General Secretary WMA. Thanks for coming to discuss with us. This is the second, maybe second or third. We discussed with the Otmar, and thanks for coming and discuss with the communication forum, the Indonesian Medical Association. Firstly, I want to explain what that's the problem in the condition of the Indonesian. The Indonesian Medical Association, the ED, IMA or ED, plays a crucial role in shaping and improving the future healthcare system in Indonesia. So it is the history as usually as strengthening and with the Indonesian Medical Association. With the ongoing process in technology and the increasing demands of the population for better healthcare services, ED or IMA is an active participant in addressing challenges and creating innovative solutions for Indonesian healthcare sector. Some key aspects related to the future healthcare system in Indonesia included the digital transformation. ED or IMA is promoting digital innovation in healthcare, such as telemedicine and telehealth, the electronic health records, and digital health application. Secondly, the healthcare infrastructure development, the ED actively advocate for better healthcare facilities by working closely with the government to review and reform the current infrastructure. Third, the strengthening primary care from years to years. ED or IMA is focused to promoting preventive care and wellness through community-based initiatives like primary care clinics. This approach helps detect illnesses early, manage chronic disease effectively, and prevent complications that lead to more expensive treatment options. The workforce development, we all know that the future healthcare system of Indonesia relies on well-trained medical professionals who can deliver efficient service at all levels. The ED or IMA is fostering collaboration with medical education institutions to improve the quality of the medical training program as a GP or as a medical doctor specialist, and increase the total number of primary care physicians as well as specialists. Public-private partnership by collaborating with private institutions, the non-government organization, and international partner, ED aims to create synergies between different stakeholders that will help expand access to quality healthcare across Indonesia. And from the pandemic, we strengthening about the collaboration, about the equity, yeah, and the medical organization professional is very, very important to help the government as the healthcare advocate. So I want to maybe sharing with the Otmar and some doctor in this forum, because I'll also take this opportunity to convey that we health professional organization will conduct, because we want to some advocate, because now we deliver about the new regulation, the health new regulation. This is the obstacles in the new regulation, and we want to advocacy effort to reject the law, reject the regulation, and we want to preparing with the collective effort. So I want to maybe Otmar can say about the declaration from the Berlin, about the WMA statement, WMA statement about the collective effort with demonstration. Or maybe this is for the warming up. If needed, we preparing with the strike. We preparing, but maybe not for strike, because I want to slow down strike. Because the regulation, the health regulation, it is no they want to change the regulation. They want to change with organization profession, not the single bar, but want to multi-bar. So I think it is very important declare from the Otmar as the WMA say about the needed of the single bar medical organization professional. So I want thanks again to Otmar, to Professor, and to the senior and the colleagues in this forum. Thanks to Forcom, and I think it's enough. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you. Terima kasih. Chairman of the Indonesian Medical Association, Dr. Muhammad Adi Kumaidi. Thank you. Dr. Titi, kita akan membacakan pengantar. Silakan Dr. Reisa Rizky Amanda membacakan pengantar dalam 3 menit atau lebih. Silakan Dr. Reisa dalam bahasa Inggris.
Good evening to all attendees, speaker, and responders. Welcome to the Indonesian Medical Association Communication Forum. Professions.
Suaranya agak sedikit, mic-nya tolong diperbaiki, kurang jelas ya. Ya. Silakan. Ya.
Profession is a group of individuals who discipline themselves to comply to unethical standards and adhere to scientific knowledge and skill that have been recognized through the process of education and research at the higher education level, and are ready to apply their knowledge and skill for the benefit of other parties. Chhaparwal et al. 2016. There are many professions in our daily life apart from health professions, namely notary, accountant, psychologist, architect, advocate, etc. The professional code of ethics plays a vital role since it directs, governs, instructs how a profession should act, conduct, and practice beyond personal interests. The professional code of ethics also show the presence of moral duties and expectation for high standards of behavior when providing public services and collaborating with professional colleagues. There are 4 professional ethic principles that must be followed: the principle of autonomy, the principle of moral integrity, the principle of justice, and the principle of responsibility. The medical profession is unique in that it is obliged by a social contract with the general public to deliver the best healthcare possible to individuals, families, and communities of all backgrounds. In 2008, the World Medical Association, or WMA, released the Sole Declaration on Professional Autonomy and Clinical Independence, which enable physicians to make the best clinical assessment and clinical decision for their patient. Professional autonomy and clinical independence are key components in providing high-quality healthcare to all patients and the community, resulting in significant improvements in public health. The medical profession has a very tight regulation to avoid arbitrariness and misuse of professional autonomy and clinical independence. In Indonesia, each profession has its own laws that mandate and protect their respective profession in their task in public services. Physicians are protected by a specific legislation referred to as Undang-Undang Number 29, 2004 on medical practice, which is still in force today. There were 32 doctors and specialists have filed for judicial review of these statutes, which draws on Amar Keputusan Mahkamah Konstitusi Number 10 PUU-XV 2017, which identified IDI, the Indonesian Medical Association, as the medical profession quote-unquote big house. However, the existence and dignity of the Indonesian Medical Association, or IDI, are currently being shaken with numerous criticism and hatred directed at IDI by various parties, conveying the message that IDI is too powerful, too dominating, and too controlling for the medical profession. In addition, collegium that were previously worked independently have faced this criticism as well. The culmination of all this is that the effort of certain parties to reduce the IDI's authority through the healthcare omnibus bill. Therefore, the question that we should ask ourselves are, how important is medical association? What is the function of a medical association? And what role should the medical association play?
Terima kasih. Oke, mungkin waktu dan forum kami persilakan kepada moderator Dr. Titi Savitri. Mohon Dr. Titi dalam 2 bahasa. Terima kasih. Silakan Dr. Titi. Ya, Dr. Titi. Menyapa Dr. Titi Savitri.
Hello, can we continue?
Ya, silakan.
Yeah, okay, thank you. So, Otmar, we are going to have these sessions in 2 languages. So every now and then you will hear, we will speak in English and then we translate in Indonesia. And before we give the time to Dr. Otmar, I would like to read Dr. Otmar's CV. So Dr. Otmar Kloiber was appointed as Secretary General of the World Medical Association in February 2005. Before joining the World Medical Association, Dr. Kloiber served as Deputy Secretary General of the German Medical Association. As WMA Secretary General, he is the head of the Secretariat and is responsible for managing and directing the WMA staff and the activities of the WMA. He provides overall leadership and strategic direction to the organization and represents the WMA to the association's members, the medical profession, the international community, representatives of government, the business community, and the public. So today, this evening, we have invited Dr. Otmar Kloiber to discuss about what is World Medical Association and what is in fact the role of medical associations in a country and the importance of having one medical association representing at the national level, and to have the mandates from the government, also to the function of medical associations as the government partners in delivering healthcare, also to learn from other countries or other nations how medical associations functions and operates, especially in German. Okay, without further ado, I would like to invite Dr. Otmar Kloiber to present for 30 minutes. Time is yours.
Thank you. Thank you very much, Professor Tidi. Thank you, Dr. Zulasti. Thank you, Dr. Mohamed Kumali. Thank you for inviting me and giving me a chance to speak a little bit about, number one, the World Medical Association. What is its membership? Why are we looking for just one member per country? A little bit also what we do, because I have seen a lot of names here on the panel. Many of you probably had never contact with the World Medical Association, so I will talk a little bit about what the World Medical Association does. And then I would like to talk a little bit about the model of self-governance in a country, in a state, by the medical association for the state and for the doctors, what it means and how that works. And I took the model of the physician chambers, which is a prevalent model in Europe, but also in parts of Africa and Latin America. And this model probably is closest to what you have in the Indonesian Medical Association, at least until now, from what I have learned when visiting you and when talking to your delegates at the World Medical Association. I will try to share my screen. Let me see whether I can do this. And I hope that you can see my screen now. Is that correct?
Yes, yes, it's clear.
Okay, thank you. Thank you very much. So let me talk a little bit about the organization, which was founded in 1947 in Paris. There was an organization before which was given up with the beginning of World War II. And in 1947, the organization was founded before the background of what got known about the abuse of medicine in my own country, in Germany, during the Third Reich. You probably all know that in concentration camps and prisons, but also in hospitals, experiments were done which were horrific. And one of the idea of the newly founded World Medical Association was then to be there to build the international platform on medical ethics, on medical deontology. And actually, already at the beginning, it was a very global organization with partners from Asia, from Africa, from Europe. Although it was still a very difficult time in 1947 to travel to Paris. Since then, the association has grown. If you look to the curve here, I'm not sure whether my cursor can be seen. There has been a dip in the 1960s when the number of members was reduced again. There was a time when there was a question, which medical associations do we want to have as members? And it was decided that it should be organizations which are independent from the government. That does not mean that they cannot be statutory bodies, which means based on law and having a function in a state, but they should be independent from the government. And so the association shrunk a little bit. And then in 1990, the number of associations has been growing again, because then many countries, especially in the former Soviet bloc and under the influence of the Soviet Union, became became democratic and could have medical associations again. And now we are currently at 150 national medical associations from around the world, and we're probably much more than 10 million physicians right now. And our constituent members are the national medical associations. However, individual physicians can also join as associate members. Now, to understand the World Medical Association, it may be necessary to look at our members and what they are. And within our membership, we have two big groups. Number one, there are the private medical associations. And on the other side, there are the statutory bodies, the chambers or orders. Now, the private medical associations, there are examples like, for instance, the American Medical Association or the British Medical Association or the South African Medical Associations. And when it comes to the chambers and orders, we have chambers like the German Chamber of Physicians, like the Austrian Chamber of Physicians, but also the French Order or the Belgium Order, or we have, for instance, the orders from West Africa, for instance, from Cote d'Ivoire, from Mali, and also orders from Latin America, which are our members. Some of those organizations of the chambers and orders, but also of the medical associations, are at the same time trade unions, which means they negotiate with employers about salaries of physicians. A good example for a private medical association, which is a trade union, is the British Medical Association. With the chambers and orders, it is, for instance, the Austrian Chamber, which is also a trade union, or the Romanian Chamber of Physicians, which is also a trade union. It negotiates about salaries. On the other hand, there are private medical associations which are forbidden to act as a trade union. For instance, the American Medical Association is not allowed to work as a trade union, and the German Chamber of Physicians is also not a trade union. So there is a mixed bag in both of the groups, as well with the statutory bodies here in blue or the private organizations. And there is also some overlap because some of the private medical associations fulfill similar functions as chambers and orders and vice versa. Now, for being member of the World Medical Associations, we have basically 4 criteria which we test from. Number 1 is the independence from government. And I will come to this a little bit later when I talk about the chambers and their work. It should be a pan-physician organization, which means that it is not a specialist body which we want to have in our membership. So not an organization only for specialists or only for general practitioners. We want to have organizations which are open to all doctors in a country. The doctors should have a chance to participate, which means there should be a democratic structure so that they can be elected into function, that they can serve in elected functions. And what we want to have in our membership is the most representative organizations, should there be several organizations in a country. So these are the criteria where we are looking for. And it is important to understand that we only take one organization from a country, and hopefully we have the organization which has a say and can speak for the physicians in the country, where we think that if that is one organization, this is, of course, a much stronger voice, as if you have several organizations which may be even competing or even contradicting each other in a country. The World Medical Association has a General Assembly, which is the highest body. It has a council, which meets twice a year, and it has some committees which work under the council in order to structure the work a little bit more. We have 3 standing committees for medical ethics, socio-medical affairs, and finance and planning, which are always meeting when the council meets, once in April and once in October. Currently, we have a leadership which is also quite diverse. As you can see, our president, Dr. Enabulele, is coming from Africa. Our past president, Dr. Heidi Stensmeren, is coming from Sweden. Dr. Lujain Al-Qatmani is from an Arabic country. She's our president-elect and will start her presidency in October. Dr. Park is from Korea as our chair of council. Dr. Kakuta from Japan as vice chair. And myself, I'm originally from Germany, as has been said. The General Assembly is the highest body, which finally takes all final decisions on our policies, currently 150 member countries. There is a council as a regional representation, which currently has 30 members. The council breaks up in the 3 committees, and the leaders of the 3 committees and the council and the presidents are members of the executive committee, which advises the chair of council and myself in the meantime when we don't have meetings of those committees there. And you see there is a secretary general, we have a council there, and we have also financial advisors who support the work of the World Medical Association. The organization, although founded in Paris in 1947, had its first office in New York at a facility of the United Nations in New York. But in 1974, it was decided to move the organization closer to the World Health Organization, which is our main UN body we work with. And so we moved to Ferney-Voltaire in France, which is actually immediately on the border to Switzerland, and it is only about 3 kilometers as the crow flies away from the headquarters of the World Health Organization. So here you can see the Lake of Geneva. This is the airport here, the stripe. This village here is Ferney-Voltaire, where we are located, and here is the building of the World Health Organization. So it's very close by. You see the...
Ich habe 18 Kontakte bei World Medical Association gefunden.
I'm sorry.
Welchen meinst du?
I'm sorry, this was my Siri, which is discussing now with me. So there is this landing strip. There is this landing strip here, and we are on that side, which is France, and this is Switzerland here on that side. So what we do is we try to reach for a global consensus on medical ethics. I said that. We give guidance on those problems. Many of you may know some of our policies. I will just in a minute come to those and speak a little bit about some of those. We deal with social medical affairs because we early on have understood that doctors, of course, work in an environment, in a social environment, and therefore we also have to look onto the social environment and have to see what is going. I'm sorry for that. My Siri is always interfering with me. Just try whether I can shut this down.
Ich konnte diesen.
Okay, let's see whether it works now. Sorry for this problem that this always starts and goes on.
Ich konnte.
One of the functions, of course, is to represent physicians to the international organizations.
Hier ist.
I'm very sorry for that. I have no idea on how I can stop this. Just a second, please. Always starts automatically, and I cannot. Can you hear me?
Yes, very clearly.
Very clearly, Otmar. You can continue.
I don't know why the Siri is.
You can continue, Otmar.
Konnte IDK, weil Siri ist nicht in seiner.
Ini ada yang ini, Dr. Julasdi, ada yang masuk yang mengganggu ininya nih.
Okay. Well.
Okay.
Okay. You're okay now.
Yeah, I think I have switched it off now. Sorry for that. You still see my slides?
Yes.
Thank you very much. So we do also the representation to the international organizations like the United Nations, WHO, I mentioned already, and many other of the international organizations, not only UN organizations, but also private organizations where we try to represent the physicians on the international level. We also deliver support for regional and national physician organizations, but this we do only on request. So we do not interfere with national or regional issues if there is not a question coming up to us, and then we try to, of course, answer those questions and try to help whenever we can. Sometimes that even includes participation in meetings, participation in talks with politicians, discussions with the press if that is desired. We certainly try to do so. And we are involved very often in the support for the development of physician self-governmental structures. That is when countries come and develop new medical associations, which they didn't have before. This was very often happening, for instance, in the post-communist area. When those organizations try to build up physician organizations, we certainly help them. And we have developed projects along these lines, from ethics to the question of development of physicians' organizations. Currently, we are, on request of our members, very much involved also in the help for our colleagues in Ukraine. And up to now, with the donations which we have received from our member organizations and from private persons, we have already brought goods, delivered medicines, medical materials, and instruments to Ukraine for more than 2.5 million euros, and we are still continuing that work with the Ukraine. Now, for the World Medical Association, we have a very wide bunch of themes which we are dealing with. This is from questions of medical ethics, which I said already, to universal health coverage, to questions of organ donations, but also things like, for instance, trade agreements and the role of trade agreements or patents, intellectual property law. What influence do they have on medicine? Where do they conflict with the work of physicians or of healthcare? I said that some of the policies you probably have heard for, even so you had nothing to do with the World Medical Association so far. The Declaration of Geneva from 1948 in a new version of 2017 is a successor to the Hippocratic Oath and has been the blueprint for many of the pledges doctors are using in this world. The International Code of Medical Ethics is a blueprint for national codes of medical ethics in many countries. The Declaration of Helsinki is, I would say, the most important document on ethical principles for medical research. There is no other document which is quoted so frequently on the questions of ethical principles for medical research. The Declaration of Tokyo from 1975 is still a very important document when it comes for helping doctors to stay out of being abused for torture, for instance, or for degrading treatment. We clearly say that doctors must not involve in such treatments, whether it's a punishment or is an interrogation. Whenever it comes to inhuman and degrading treatments, doctors must stay away from that. And that is also a point of the Declaration of Malta, the last item here, which is, of course, about very specifically the question of force feeding of prisoners, which we say is not okay. You are not allowed to, as a physician, to force feed prisoners. Not to mix this up with artificial nutrition, which sometimes can happen when people are unconscious and then need this. But basically, it is not the role of a physician to do any degrading or inhuman treatment to people. And the Declaration of Lisbon from 1981 is our document on patient rights, where we very early now, more than 40 years ago, started to think about what are the rights of patients, which rights do they have against the healthcare system, against the doctor. And we put this into the Declaration of Lisbon, certainly as one of the first organizations there thinking about that. We have three types of documents we work with as policies: resolutions, which are very specific, limited in region or time, so they address a very specific matter at a certain time. Statements are dealing with more overarching problems, and the declarations we call the very fundamental documents which we have, which we think are the core ethical documents. How is this being done? How is this being made? Now, when a proposal for policy comes to the World Medical Associations by member organizations, like, for instance, the Indonesian Medical Association or another medical association, it goes into a committee of the council. There will be a call for comments, and then members can comment on that. It goes back to the committee together with the ideas members have brought us, the criticism members have brought us. And when a document is ready and the committee, the council feels that this document is finished, it sends it to the General Assembly. And the General Assembly then, if it is adopted and the General Assembly finds it is correct and is necessary for the World Medical Associations, give it to the Secretariat for international implementation if there's something in relations to, for instance, the United Nations, the World Health Organizations, or other international organizations, and it gives it back to the national medical associations for national implementation, so that the national medical associations should work with those documents. And you see, wherever it is read, all the national medical associations are being asked to participate and to give input. And when we meet for a General Assembly, we usually have something like 250 to 350 people coming together to meet for such a General Assembly once a year, usually in October when we do this. I will now skip through some of the decisions which we have taken over the past years. You will find this in my documentation, in which I will share with you, and you can read about the current policies which we have taken. You can find them as well, of course, on our website. Just a word about our strategic plan. We have a strategic plan which covers about 5 years. And in our current strategic plans, we have 3 major issues there, which we are addressing. Number 1 is the medical ethics part, which I said already is the core work of the organization since 1947. We have fulfilled already some of the parts here. We have a new International Code of Medical Ethics, which we adopted last year. We are now working again on the Declaration of Helsinki for the ethical rules under research. We are very much working together with the World Health Organizations on the issue of universal health coverage. And I remember a couple of years ago, you in Indonesia have introduced also a health insurance, which is thought to cover all the people in the country and to serve everybody. And that is something which we want to have and want to see in all countries of the world. And there are many countries which don't have that at all. And what we need really a situation where everybody gets the health care the person needs and wants at the time when they need it. And they should not be impoverished by getting the health care. That is very important. So nobody should fear to ask for health care because they get impoverished by seeking health care. And the third big column is, of course, human rights and health. As I said, we have spoken about the Declaration of Tokyo, non-involvement of physicians in torture. We are dealing with questions where physicians do wrong things, but we are also, and this is unfortunately very often the case, dealing with questions when in healthcare, human rights are violated against patients or against doctors. And those are things which we are dealing with very often on individual level, but sometimes also on the policy level that we do. Now, let me come back to the membership questions and to the idea of physician organizations as part of a self-government. And here I will focus on the type of organizations like the chambers and orders, because from what I have learned in my visit in Indonesia and in the talks with you, this probably is the closest what you are, and you probably belong into this family. Now, the European chambers of physicians have met several times in the past, and in one of their meetings in 2000, they have made a memorandum which very clearly summarizes the functions and the roles of such chambers of physicians, of such statutory bodies, many of which are members of our organizations of the World Medical Association. And the very special thing, and I think that is something which you have as well in the Indonesian Medical Association, is that you have dual functions. On one side, you have a task which is given to you and to the chambers of physicians for the general public, to guarantee high standards of medicine and the ethical provision of the medical services by doctors. That is something that very often is entrusted by governments, by states, to the medical association, to the chamber here. And the second role and the second function of that is, or group of functions, is to serve the community of physicians, to give them a democratic representation towards societies, to the administrations, to politics, and also to provide communal services for physicians. So two very different functions, and many private organizations don't have this duality. They do only one thing and not the other. But the chambers of physicians and the orders, they have usually both functions, and they have these dual functions in one organizations. I will copy you the memorandum of Český Krumlov. It's a very short document. It's just 2 pages where all these functions are listed, so that you can see and compare with what the Indonesian Medical Association does. Now, when we come to the functions, as I said, you can distinguish between the 2 different functions there. And here it is the public functions for the chambers of physicians. And there is a list of functions which have been given by the lawmaker to the physician organization and has said, you do this because we trust that you as a physician organization can do this best in looking for your colleagues and looking after your colleagues. And the most important, and that is very similar in all of that, is the development of a professional code. The young lady before spoke about this, and also the supervision of the profession. Not only to give the code, but also to supervise it. Now, this alone means you need to have obligatory membership. You know, you cannot do this, and some people say, okay, I'm happy with that, and I go under the professional code, and the others say, well, I don't care, I'm not a member, so I don't have to care for the professional code. That doesn't work. So if the state entitles the organization to build this and to regulate this, then there has to be, as a logical consequence, also an obligatory membership. In many of those, not in all, but in many of those, you have other functions, like, for instance, the regulation and supervision of postgraduate education. This is a little bit different from country to country. For instance, in my country, in Germany, this is completely in the hands of the chambers. In France, the order has a regulatory function, but the universities play a very strong role. So it's a little bit different from country to country. Depending on which country you are, the roles are a little bit differently distributed. The chambers usually have the obligation to look into the continual professional development, the continual medical education. So they accredit those continual medical educations which is important for your professional development and which you have to demonstrate that you have done CME. But the CME is only valid if it has been accredited by the chamber. If it has not been accredited, you can do this, but it doesn't count as CME, which has to be documented. We deal with questions of quality insurance as chambers, which means nowadays you would call it quality development, to build up structures for physicians where they can check on the quality of their work and develop this quality. In many of the countries, not in all, the physician chambers also organize ambulatory emergency service. This is not the rescue service by the fire department. This is an ambulatory emergency service which makes sure that at any time of the night or during the weekend, there is a doctor which can be called, which can be visited, so that there is a practice open for the non-life-threatening cases. Everything else is being done by the rescue service, and not by this service. The chambers usually offer arbitration between members if there are fights, but also arbitration between patients and doctors. For instance, about medical mistakes that have been made. So the chambers usually offer services to regulate medical mistakes, to look for compensation of patients, and they offer a platform to do this so that patients don't have to go to court in order to get their right. And this is a very successful model, especially in my country, in Germany, and it avoids that patients go to court and seek compensation through a court procedure. In some of the states, the chambers are in charge of licensing the doctors. In all of the countries, they do the registration if they once they are licensed. In some, again, they also do revocation of licenses if doctors failed and produced non-behavior or showed non-acceptable behavior or serious mistakes. The chambers are also entitled to defend the economic interest. As I said, some of them are even trade unions, not all, but they all have the right to speak for the economic interest of their doctors. And that is also a very important function when they discuss with governments, when they discuss with employers, when they discuss with hospital companies or health insurance companies. And the chambers, of course, have a role in cooperation with the public health service. So they are there to support the public health service. They are not only there for the doctors in practice or in hospital, they also have to look for the public health structure. On the other side, there are these functions which are more the society functions of the doctors, which are the functions for the community of the physicians. So they represent the physicians in politics and media. So there is a role to speak for them, as you do in Indonesia as the chair of the Indonesian Medical Association or of regional medical associations in Indonesia, and represent your doctors versus the politicians and the media. These chambers usually give statements on laws and other regulations which are being prepared by parliaments before they go into the parliamentary decision-making. They give expert opinions to courts or to politicians if they desire this, and if the courts ask for them, then the chambers provide this opinion by naming experts, one or several experts, in order to be there as expert witness, for instance. And the chambers, most of them publish their own press organ, which means is a doctor's bulletin or a journal that speaks about the work of the physician organizations and the interest of the physicians. Many of the chambers of physicians also have some welfare functions. Some of them have pension schemes. In my country, for instance, the pension scheme of the physician chamber is substituting the public pension scheme. So if you are a physician, you are out of the public scheme and you go into the pension scheme of your chamber. In other countries, like for instance in Austria, it is an additional pension scheme which you can opt in and can have additional retirement benefits, for which you of course have to save money and have to pay. And in some of the countries, the physician chambers also provide the welfare for physicians, and that is a function that may or not exist in some of the countries again. What is of crucial importance is that the chambers are independent of the government, and they are only supervised for the obedience to the law, which means that the government supervises the chambers whether their actions are in line with the law, or a court may do this, like for instance in Poland. In Poland, it's not the government. In Poland, it's done by the court. But the government cannot tell the chambers on how they decide on medical issues. So let me give you an example. For instance, in my country, in Germany, the chambers regulate the postgraduate education, and they determine which specialties are there. And the law requires that this is to be done in the interest of the patient care and the development of medical science. So these are the two requirements which have to be met by that, which are very basic. And now the chamber can structure its postgraduate education according to this law, as I said, very basic. And if the Minister of Health supervises this. He has not the chance to say, well, I don't want it this way. I don't want you to have this 5 years, but 6 years, or instead of 5 years, 4 years, or with this and that requirement, and with this and that separation from other fields. He is not allowed to do so. He only can find whether this is in accordance to the law or not. And if it is, then he has to let this go through, and it will be enacted as a binding regulation for all physicians in the country. So there is a very strong role of the physician self-government in regulating the profession, in supervising the profession, and the government or the court rule is just to see that this is in conformity with the existing laws, but it cannot give them medical orders and give not them medical advice on that. Of course, in the background, there is always discussion with the Ministry of Health. You know, they will tell you what their wishes are, what their ideas are, and then the chamber will have to negotiate with them and seeing what are the requests by the government. You are not acting in a free, how should I say, in a vacuum. You are in a society, and of course you have to respond to society and to social needs. There's no doubt about that, and the government also will tell you. But when it comes to the details, they are out, and this is a function that the medical association has to do itself and to structure itself without influence then of the government there. So this is a very important point which I wanted to make, that this is a separation. And I think with that, I would like to stop speaking about the organization, and thank you for your attention.
Okay, thank you very much, Otmar. So would you allow me just to summarize in Indonesia what you have discussed? Jadi tadi Dr. Otmar sudah menjelaskan tentang apa itu World Medical Association. Untuk detailnya, bagaimana fungsinya, kegiatannya, sejarahnya, bisa dilihat di website. Nah, yang paling penting adalah penjelasan beliau tentang ini, jenis-jenis medical association. Yang tadi beliau sebut chambers. Chambers itu adalah ya association juga, association dari para dokter gitu. Nah, menurut beliau dari sekian anggota yang menjadi anggota WME, memang ada satu saja yang diterima atau diakui untuk menjadi anggota WME. Nah, dari sekian 115 anggota tersebut, ada medical association yang mendapat mandat dari undang-undang. Ini yang dia sebut sebagai chambers tadi atau orders. Jadi karena mendapat mandat dari undang-undang, maka medical association ini punya beberapa fungsi. Ada public function ya, berfungsi untuk masyarakat, mulai dari menyusun kode etik, menyusun standar-standar pelayanan, mensupervisi profesi, meregulasi pendidikan spesialis, continuing education, bahkan juga memberikan licensing, registrasi, credentialing dari dokter, ya, termasuk arbitrasi tadi kalau ada dispute, ya, ada masalah antara dokter dengan dokter dan dokter dengan patient. Nah, itu adalah public function dari medical association, ya, organisasi profesi yang mendapat mandat melalui undang-undang yang dia sebut sebagai chambers tadi. Nah, selain punya public function, juga ada social function tadi, terus ada fungsi yang memang untuk mengurus komunitas dokter itu sendiri, gitu ya, baik tentang kesejahteraan dan sebagainya. Nah, medical association yang mendapat mandat melalui undang-undang yang beliau sebut chambers itu tidak bisa berfungsi sebagai trade union, ya. Jadi keliru sekali kalau ada beberapa pihak yang mengatakan bahwa ID itu adalah union. Itu nggak benar menurut beliau, ya. Nah, di sisi yang satunya lagi ada medical association itu yang muncul bukan karena mandat undang-undang, tapi karena inisiatif dari asosiasinya. Jadi benar-benar NGO, ya, benar-benar private. Contohnya adalah di Amerika, American Medical Association, ya. Nah, asosiasi dokter ini, medical association yang private atau yang dibentuk sendiri oleh sekumpulan dokter tersebut, itu bisa menjalankan fungsi sebagai trade union gitu. Ya, ini beliau membedakan betul ya. Jadi medical association yang dibentuk oleh atau yang mendapat mandat undang-undang tidak bisa berfungsi at the same time ya pada saat yang sama sebagai trade union. Tapi medical association yang dibentuk oleh kalangan medical association itu sendiri tidak ada mandat dari undang-undang, itu selain bisa berfungsi sebagai OP, organisasi profesi, juga bisa berfungsi sebagai trade union. Dan contoh yang klasik adalah di Inggris. Memang di Inggris saja yang British Medical Association itu mendeklar sebagai trade union, selain juga sebagai OP. Ya. Sedangkan di Amerika tidak. Nah itu sangat jelas sekali kita melihat positioning di mana posisi ID gitu. Oke, Dr. Otmar, before we move to discussion, we already have 4 colleagues that will respond or will give comments to your presentations. First, we have Professor Dr. Hafil Budianto Abdul Ghani. Professor Hafil,
Hello,
okay, time
yes.
is yours. Yeah,
Thank you.
for about 5 minutes to
Thank you.
respond to Dr. Otmar.
Thank you,
Yeah,
Professor
Professor
Kloiber.
Hafil is a very senior person, and he has a lot of positions, and at the moment also World Society for Pediatric and Congenital Heart Surgery. Okay, Professor Hafil. Thank you.
Thank you. Thank you very much, Professor Kloiber. I enjoy your talk very much. You really alluded some crucial point that we in Indonesia has come across at the, I would say, at the crossroad. But there are important point that you mentioned regarding the public function, where there is obligatory membership and that there is regulation and supervision of postgraduate education. This is all are within the framework of our omnibus law that is going to be implemented or discussed soon. And another thing is about the association are independent of the government, only supervised for obedience to the law. Can you allude to me, what do you mean by that? That we are independent, but only supervised for obedience to the law? Because there is a term here that we are facing, which is our association, the Indonesian Association, is a partner of the government. But this kind of relationship where they are supervised for obedience to the law, I don't think it's really intended in a very sense of the partnership. Is that really correct term, that we have to be a partner of the government? That's number one, my question. Number two is, there is a rise of, you know, that there is a rise of consumerism in the healthcare, and there is also loss of power of the doctors. And we have been talking about autonomy and so forth and so forth. And many of the doctors, and perhaps in the future in Indonesia, will work as employee and subject to regulation imposed by different stakeholders, including government, health maintenance organization, and healthcare insurer. And this all has impacted in our future modern medical practice. With that in mind, do you support that in case that there are dispute or disagreement, that the World Medical Association support such action as strike? Thank you very much.
Okay, Dr. Otmar, would you like to respond immediately. You're still muted. You're still muted.
Now I should be online. Yeah. Okay. Now you hit very important topics of the current developments in our time, no doubt about it. But let me first speak about the question of the relationship and the obedience to the law. The chambers in most of the countries are, as I said, statutory bodies, and their basic functions are being described in a law. So, for instance, for the chambers, you probably will have then the same thing in Indonesia, I assume, that there are some functions being described by law. The law, on the other hand, made by the parliament and decided by the parliament, gave the chambers the power to structure their business, their medical business, themselves. So it is within the organization that they decide on how specialist education, for instance, looks like. Which tasks you have to do in order to become a specialist, how long it takes, for instance. It also gives the chamber the right to produce an ethical code, to define what is proper ethical behavior. And of course, all these regulations have to be in accordance with general laws in the country. So you cannot break a general law with an ethical code. You can even only be stricter and more precise than a law, but you cannot break it. So what the government can do is the government can check on this, whether it is under the law and conforming with the law, but it cannot say you do this or you do that. So, for instance, when there is a decision between what belongs to a field in medicine, for instance, let's say spine surgery, does belong spine surgery to neurosurgery or does it belong to orthopedics? This is something which in my country, in the specialist education, the chambers have to regulate on how they deal with the intersection of those fields. It is not the Minister of Health who can do that. Once the chamber has said this, then the minister will put this in power and makes it a binding regulation. But he cannot decide on that. So he can only check, is it in relation to the law, under the law or not? If it is under the law, he has to sign it. If it's not, then he cannot. So, but he cannot go into the details with that. And that is true for many of the functions of the chambers, what chambers do, how they decide on ethical issues. The influence of the government is very limited. Is it a partner to the government? Ideally, yes, but not always. We criticize the government, we criticize the parliament when they do law proposals relating to healthcare and to social issues in healthcare, where we believe that they are not correct. For instance, in the structure of the health insurance, when we believe that for medical reasons, a law proposal is wrong, we will criticize the government, we will criticize the parliament if necessary. So, yes, ideally, we are part of the society. The chambers have a very strong function towards society, which is given to them by the sovereign, by the parliament, but they also act very independently. And this may mean to criticize the government, to criticize the parliament, to criticize politicians or parties in the field. Now, coming to strike. Strike is in most countries highly regulated. In most of the countries that I know, strikes are limited to negotiations about tariffs and working conditions. So, for instance, in most of the countries I know in Europe, you can go on strike when you are fighting about your salary, when you are fighting about your working conditions and the contracts that are made with that. And the right to strike is a very basic right in all the countries that is not been taken away because you have a white coat. You know, when you take on a white coat, you do not give up your human rights. And you do not give up your right to strike, basically. Now, of course, a strike in a hospital is something different than a strike in a factory, because we will not leave patients alone. You will not leave a patient in agony and in pain. You will not deny an operation that has to be done on the day. The possibilities to do strikes are very, very limited. No doubt. And what I have seen, which were successful models, the unions have always made contracts with the hospitals which would be subject to strike and offered them emergency plans, so that there is somebody looking after the patients, that the necessary operations are being done, that nobody is there in pain. All these things must be taken care before you can have a strike in healthcare. Because once something happens in a strike, the whole nation will be against you. You can do what you want. So a strike must always be done having in mind that nobody is being harmed by that. There may be some discomfort by not being operated today, but being operated tomorrow for elective procedures. And we have seen patients are tolerating this, but there can be no emergency treatment being denied and no necessary treatment being denied. This has led in many of the countries to very innovative strike forms. Actually, I would say there are more demonstrations than strikes. You know, when our trade unions strike, for instance, in my country, in Germany, they do this during the day. You know, they have picket lines during the day, and there may be TV cameras coming. When the doctors striked, and we had a very big strike in my country, in Germany, 2006, what they did is they said, we strike at midnight. And they got torches in the hand. They were standing in the middle of the city and had the torches in their hand and were on strike. And because this was so extraordinary, because nobody would strike at night usually, all the cameras were there, all the press was there, and it got attention. And of course, nobody of those doctors was really on strike. They were doing a demonstration, you know. I mean, everybody was working in the hospital who had to be at the hospital at night, and no patient was left behind. There were 3 or 4 doctors in a white coat climbing the highest mountain in the country, in a white coat, had a transparency and saying, we have a summit strike. Was just 4. But there were 40 TV teams there in order to take a picture of that. So we have developed very creative forms of these industrial actions to say our protest. And that is something where the doctors have been very creative. And what we knew from surveying the population is that was very successful. So they got a lot of support from the people for the ideas of doctors and for their needs. But as I said, strike in healthcare is very difficult, very complicated, and as soon as you do harm to anybody, you have a very big bad card in your hand, and that is very devastating. I hope I answered your questions.
Thank you. Thank you very much.
Okay, thank you very much, Prof. Hafil and Dr. Otmar. Jadi secara garis besar beliau mengatakan strike itu mogok di negara-negara Eropa, negara Barat, memang itu hak dasar, dan biasanya strike itu dilakukan untuk memperjuangkan perbaikan kondisi, perbaikan salary gitu. Sedangkan strike yang di luar itu jarang dilakukan, dan strike di dalam healthcare itu sangat limited dan harus diperhitungkan secara matang, terutama bagaimana kelangsungan pelayanan. Jangan sampai strike menimbulkan ada yang disakiti tadi ya, harmful, sehingga malah akan menjadi bumerang bagi OP. So now we have the second panelist, Dr. Priyo Sidi Pratomo. Dr. Priyo, okay. Dr. Priyo is the chairman of Indonesian Medical Association a couple of decades ago, maybe. Okay, Dr. Priyo, time is yours.
Thank you very much, Bu Titi. Good evening, everyone. Of course, for Otmar, good afternoon, maybe. So I met you. This is the third time, Otmar. The first time I met you, I think somewhere near Otani Hotel, there was a meeting with WMA 2011 or 2010. And then the second time in Indonesia, it was in Bali. We have the same project at the time, 2012. So this is the third time for me to meet you. So the society asked me to talk about the title, the importance of single medical association as a government partner. I think I don't want to use this presentation. I will directly discuss with Otmar. So actually, the spirit of decision plates based on the Declaration of Geneva and also Declaration of Helsinki. As you mentioned already, that Declaration of Geneva is revision by 2017, I think, in New York. So this is actually the spirit of the medical association. Everywhere, in every country. So the spirit of it is actually based on the Declaration of Geneva, Declaration of Helsinki, and that has become the goal of medical association. And what we know, this is as a component also as a medical ethics. So based on that philosophy, actually, the medical association should always one in every country. Never we have more than one, because this philosophy is still the same. And as you explained to us regarding your country, I think my country on the track, the same track with your country. But my question is, in your country, the government and the policymaker, like the parliament, they are agree with that concept. This is what in the opposite side in Indonesia nowadays, they are not willing to give it to the medical profession. They want to make the regulation and they want to do it by their own. And as I observed from your lecture, actually, my country is already on the same track with your country in Germany. And my question is, what happened actually regarding with the healthcare industry? Because in your country, the healthcare industry is also so advantageous compared us here in Indonesia, but still the medical association, what you call it chamber, still is in the independence, still in their own power. And now in Indonesia, we are trying to make it on the other hand, in your country. So my question is, what is the healthcare industry role in your country, especially in influencing the government and also parliament? Thank you, Otmar.
Okay, Otmar. Jadi
Yes,
saya terjemahkan dulu, ya. Okay.
Yeah, there is some noise in between, where obviously there is some channel open which should be better closed.
Oh, Titi, mic Dr. Priyo kayaknya. Oke, udah.
Oke.
Udah. Masih.
Yeah, okay. Thank you. Thank you. It has gone away. Yes, the healthcare industry actually is getting to be more and more a problem in many of the countries, in my country, in Germany, as well as in many other countries, because what also the previous speaker said, there is a lot of consumerism, there is a lot of commercialization of healthcare, and this indeed is a big problem. It is a big problem because the commercially operating companies, whether they are being owned by the state or owned by private entities, doesn't matter. They try to either, if there are insurances, to spend less money on patients, or if there are hospitals and provider companies themselves, to make more money on patients. And both, of course, is contradicting our ideas of good medicine, at least in many times, not always, but many times. And that is something where a very strong medical association indeed can support the individual physicians by giving proper guidance, by making specific rules on what is professionally correct and what is not, and by that supporting physicians in taking decisions. I am very much convinced that one of our ethical rules has to be that we take medical orders only from physicians and from qualified personnel, and not from lawyers, economists, managers who tell us how we should treat patients. And this is something where a medical association has a very strong role, what I would say, to keep the back free for physicians so that they really can act. And that is what many of the organizations try to do in order to fight for the professional autonomy, for the clinical independence of their members, of their physicians, and counteracting a little bit the power of commercial companies, of insurance companies which don't want to pay for the services. So there is a very strong fight that is going on. And yes, unfortunately, I think currently the tendency is much more going into the direction of commercialization and of commercial pressure to doctors than the other way around. I see now that some people understand that there is a problem, and more people understand that they have to act on that, but it is still not enough. And still governments, sometimes even themselves, think it is a good idea to press out more money from healthcare, because they believe that healthcare is an expense and not an investment, which of course is a basic mistake. But yes, you are right, this is a big problem. But on the other hand, I think only a very strong medical association and a unified medical community can forcefully act against that. If you are yourself splintered into various groups and have no power to unify you, then it is very easy for commercial powers, but also for government powers, to divide you and to divide and conquer.
Okay, so please allow me to translate quickly. Jadi Dr. Priyo menanyakan tentang tadi ya healthcare industry, bagaimana di Jerman, di sana healthcare industry jalan, tapi OP-nya tetap berjalan gitu ya, tidak ditekan seperti di Indonesia. Nah, jawaban beliau, memang saat ini healthcare industry itu menjadi masalah di banyak negara. Terjadi komersialisasi healthcare dan ada kecenderungan mengurangi budget healthcare untuk pasien, dan juga mengontrol, mengendalikan bagaimana medical profession, jadi para profesi dokter itu dalam memberi pelayanan kepada pasien. Nah, menurut Dr. Otmar, justru disinilah peran OP untuk membackup para dokter yang praktek, memberi support agar yang memberi pertimbangan utama dalam menentukan what is the best, apa yang terbaik untuk pasien, itu adalah tetap kelompok dokter ini gitu, bukan manajer, bukan asuransi. Ya disinilah peran OP sangat penting untuk memperjuangkan agar standar itu tetap yang terbaik untuk pasien. Dan menurut Dr. Otmar, pelayanan kesehatan itu adalah investasi, bukan expenses ya, bukan spending. Tapi banyak pemerintah negara yang melihat itu sebagai suatu beban anggaran sehingga cenderung dikurangi. Demikian. Next, we will invite Dr. Zul to ask questions. Dr. Zul.
Dr. Iqbal, terima kasih.
Ya.
Dr. Dani, Dr. Zul.
Dr. Iqbal.
Ketua
Dr.
Umum
Iqbal.
PPID, Dr. Iqbal.
Oh, Dr. Iqbal, okay. Okay, time is yours. Dr. Iqbal is our colleague who live in Qatar. Yeah.
Okay.
This time is yours.
Thank you very much. Yeah, first of all, thank you very much, Dr. Titi, for giving me an opportunity to raise my question. Also, let me take this opportunity to thank Mr. Otmar for very comprehensive information delivered to us, very fruitful, very useful for us regarding the position of the professional organization in general in the world. Before giving my suggestion and also my advice regarding the current situation, let me just update you regarding the current situation of the professional organization in our country. We know that professional organizations such as medical organization play a very crucial role in maintaining the medical ethics. This is absolutely, we know about this one. And in the Indonesia, so far, the single professional organization is given an authority to manage medical ethics and some other tasks. As consequences so far, the Association of Indonesian Doctors in Indonesia, they have the right and they have the authority to give the recommendation to the doctor who wanting to practice. So each doctor in this country who want to open the practice, they need to get the recommendation from Indonesian Medical Doctor Association, because this recommendation can give like confirmation that he or she has no medical ethics so far. Now we're facing an issue is that the government want to take this rule. They start to draft and start to discuss about one rule that we call omnibus law, in which inside the omnibus law, they started to propose the possibility that professional organization should not be single, because so far we enjoy the single authority of professional organization in the country. But the government, they want to change this rule. They want to create more than one professional organization. And each professional organization definitely can raise the ethical issue. And apparently they don't care about the potential medical ethics which is arising from this condition. So it seems to me the government want to close their eyes and they open opportunity that medical organization in this country should be more than one. And as a result, we are worried about the possibility of the medical conflict which is raised by each of medical profession. And also at the same time, the government want to take all the privilege that they have given so far to our professional organization. They want to take a lot of tasks, except they want to leave this organization has no rule except to be the trade union. The reason is that they usually say that the government is to govern. So the function of the government is to govern. And because of this one, they want to take all these tasks, all this responsibility that so far belongs to the Indonesian Medical Association. To us, this is a big issue. Now, I just want to ask your opinion as an expert in this professional organization. What is your opinion if the professional organization in one country like in Indonesia became multi-organization, multi-bar organization, in which many organizations can present a professional organization? What the effect of this multi-organization on medical ethics? Is there any possibility of conflicting medical ethics between one organization to another organization? And second issue I want to raise, what's your opinion regarding what's the government want to take all these tasks? They all ultimately always say that the function of the government is to govern. So because of this principle, they want to take all the rule which is belong to Indonesian medical association organizations so far. What is your opinion regarding this one? And I want to see how you can compare the situation in Indonesia with the situation in other countries in the world. The situation in our country is exceptional or extraordinary, or this is just like something which is common happening everywhere. I think this is from my side. Thank you, Dr. Titi. Thank you, Dr. Otmar.
Okay, I think Dr. Otmar, you can respond.
Yes, thank you very much. Yeah, the situation is, of course, a little bit different from country to country. And there are nuances about what medical associations do from country to country, different here and there. Let me give you, for instance, a peculiarity of my country. In my country, the highest court, the Constitutional Court, has said what determines about entering into a profession or not cannot be done by a chamber, must be done by a government. So that means in my country, when I have taken my exam, the government gives me the license. And with that license, I go to the chamber and I am obliged to become a member of the chamber automatically. And I am under the supervision of the chamber and under the ethical code of the chamber. If the chamber finds or a court finds that my license should be revoked, then they report this to the government and the government will revoke the license. In other countries, this has been done by the chamber directly, without the government. To make it even more complicated, very recently, some of the German states which are in charge of doing this have said they don't want to do this anymore, and they have said, you, the chamber, do this under the government control, giving license and taking away the license. So there is a very mixed bag on that. But there is only one organization which provides the ethical code, under which all is regulated, which is the chamber. Even so, in most of the European countries, for instance, or also in other parts of the world, there are several medical associations, actually several general medical associations. In my country, for instance, there are two big general medical associations, and there is a big trade union in which most of the employed physicians are members. I am as well a member in the trade union. But when it comes to the overall representation of all physicians, when it comes to the setting of the ethical code, there is the chamber. And the chamber decides on what it is. In the elections to the chamber, these big medical associations, these general medical associations and the trade union act like parties. And they present candidates for the board. And you can choose from one of the lists and elect along the lists. So there is a very different situation from country to country, but what you have is you have usually one which is in charge of setting the ethical standards, of taking the lead, of being empowered to speak for all physicians in the country when it comes, for instance, to the international relations. And that is either, like with private organizations, the strongest one, like, for instance, the American Medical Association in the United States, which is a private organization, or it is the statutory body, like in France, in Germany, in Austria, in Czech Republic, in Poland, in Italy, in Portugal, in Spain, in Mali, in Chile, and in many other countries of this world, in Indonesia right now. Is it an advantage to have several which are competing about making a professional code? No, definitely not. I mean, what you get then is insecurity, you get uncertainty for patients. Patients don't know which of the rules are valid. Patients don't know whom to turn to. Does the government do themselves a favor with that? Most likely not, because dealing with this is damn difficult, is costly, and it's not fun. So if your government really wants to do that, they should be aware that this is probably a task which is not really pleasant for them, and they will probably not get a lot of friends with that, but they will get a lot of problems with that. So the physician organizations are certainly better suited to do this. In my experience, they are also actually much stricter than governments when it comes finally to enforce discipline of physicians, but that is another issue. So your government is certainly not really very well advised in trying to take this over and to take the privileges and the roles and the obligations away from the Indonesian medical associations. And to me, these are actually obligations and tasks and not that much privileges which the Indonesian Medical Association has and which it fulfills. So you are on your own doing a service for your society, which you are not paid for, which you are do on your own shoulders, and which is a public service to society. And if your government is taking that away, they will have to find ways in how to substitute for that, which will be damn expensive and will not be fun for them. Back to you, Titi.
Let me just continue my question, Dr. Otmar.
Okay.
I think I agree with what you said. That to some extent, basically, if we create the opportunity that some organization, professional organization exists together in one time, it will create a turbulence, in my personal opinion. It will create some issue, medical ethics, conflicting of medical ethics, etc. So let me just ask you from your perspective, is there any possibility if World Medical Association can provide advice, for example, like the evidence-based advice to our government to give information that, look, if you want to try to create a multi-organization, professional organization in the country, it will create some big issue in the future. Any possibility if World Medical Association can do that for us?
Muted. Omar, you're still muted. Yeah,
Thank you. I have it. We certainly can help you with the political argumentation, whether there is enough evidence so that we can say we have numbers of experience of that happening. I probably must say, no, we don't have, because there is no case like the Indonesian, similar case like the Indonesian Medical Association. There are cases which have similar features, like for instance, in Hungary, we have a chamber. The chamber is across with the government, and now the government wants simply to take away the obligatory membership, but not the other functions. You know, they don't say we take away other functions, we just take away the obligatory membership. So there are similar cases, but not the same. And to that extent, it will be difficult to speak about hard scientific evidence, but there is certainly experience that we can share, and certainly speak in favor of your role as a medical association unifying the profession in the country, and that this is actually a service to society and is a benefit to society, and that splintering this up may please your government for a minute, but in the long run, this is producing only damage.
Yeah, I think, Dr. Otmar, thank you very much. I think, Dr. Titi, I think this is a great opportunity for us, in my personal opinion. I mean, because if we give advice to the government, to some extent, maybe they will disregard that. But if we have some like professional advice from Dr. Otmar, from the World Medical Association, definitely, this will give some like fruitful advice to the government. I think this is a good opportunity for us, Dr. Titi. Thank you very much, Dr. Otmar, for your information. Yeah.
My pleasure.
Yeah, thank you, Dr. Iqbal. Your suggestion is very good. We will coordinate with Dr. Abdi from the Indonesian Medical Association, the president. Maybe we can arrange such event where we will invite also the Minister of Health and also Dr. Otmar, so there can be a dialogue, and the Minister of Health or the Director Generals, they can directly get the information from Dr. Otmar. Just please allow me a couple minutes to explain what have been discussed. Jadi Dr. Iqbal sudah menjelaskan tentang situasi di Indonesia. Kemudian Dr. Otmar mengatakan bahwa situasi di Indonesia itu intinya unik gitu, intinya unik. Artinya tidak ada yang seperti di Indonesia, di mana pemerintah malah mengambil fungsi-fungsi OP untuk dikerjakan oleh pemerintah, sedangkan OP malah dikecilkan hanya menjadi trade union. Itu tidak jarang yang terjadi seperti itu, mungkin hanya di Indonesia gitu. Dan menurut Dr. Otmar, kalau ini terjadi in the long run justru efeknya adalah malah mendamaging ya, merusak sistem, merusak situasi. Mungkin dalam jangka pendek ini menguntungkan atau menyenangkan pemerintah, tapi dalam jangka panjang akan merusak gitu. Jadi fungsi-fungsi OP itu yang sudah ada itu yang dilakukan sebagai mandat dari undang-undang, OP memberikan public services kepada masyarakat, itu menguntungkan masyarakat. Di banyak negara memang ada beberapa OP, tetapi ketika mewakili secara nasional, representasi nasional maupun internasional hanya satu gitu ya. Jadi semua OP itu bergabung dalam satu OP yang lebih besar. Itu sebetulnya ini mirip-mirip dengan PBID begitu ya. Di bawah PBID juga ada banyak organisasi, tapi kemudian representasi di tingkat nasional tuh ya hanya satu, dan juga representasi di tingkat internasional hanya satu. Dan tadi chamber itu adalah OP yang statutory body, artinya OP itu mendapat mandat dari undang-undang untuk melaksanakan fungsi-fungsi tadi. Dalam kondisi ini maka setiap dokter yang praktek wajib menjadi anggota, jadi itu obligatori ya. Jadi tadi kan ada dua kelompok OP ya, OP yang chamber tadi mendapat mandat dari undang-undang, sama OP yang dibentuk oleh masyarakat komunitas dokter gitu. Nah, yang OP mendapat mandat dari undang-undang ini, maka keanggotaannya itu adalah wajib gitu. Jadi ini sudah terjadi di Indonesia. Baik, next we are going
Dr.
to
Titi, mungkin Dr. Titi bisa saya sedikit, Dr. Titi?
Boleh.
1 menit. Mr. Otmar, I'm sorry, I just try to speak Indonesian to my colleague. Yeah, it's just maybe 1 or 2 minutes ya. Teman-teman sekalian, mungkin kita bisa mengambil opportunity ini. Tadi kan Dr. Otmar sudah menjelaskan bahwa kalau ada multiprofesi itu potensi untuk devastating itu sangat besar. Itu nanti at the end itu akan sangat merusak gitu. Jadi tadi saya mengusulkan bagaimana kalau kita meminta professional advice dari WMA ini, itu ditujukan kepada pemerintah bahwa berdasar experience so far dari WMA ini, itu sangat devastating kalau satu multiprofesi. Mungkin kalau kita yang mengajukan, kita itu dianggap bias ya, karena kita kan anggota ID gitu. Tetapi kalau yang membuat statement ini itu dari Otmar atau WMA, itu saya kira efeknya itu akan, magnitude-nya itu akan sangat bagus. Ini dari saya. Terima kasih. Thank you, Mr. Otmar. Thank you very much for your information, fruitful information.
Dr. Iqbal, tadi dari Dr. Otmar sudah mengatakan bahwa WMA bisa memberikan bantuan ya kepada medical association yang membutuhkan, tapi based on request. Nah, nanti mungkin kami minta Dr. Muhammad Adib ya.
Ya, dengan izin izin Pak Ketum.
Ya, requestnya dari Pak Ketum, requestnya. Ya. Dr. Adib, monggo.
Tentu saja dengan izin Pak Ketum.
The letter deliver to the WMA to Otmar. So I want to answering the letter from the WMA. So also, yes.
Okay.
Thank you.
So, Dr. Adib will...
Thank you, Dr. Iqbal.
Ya, jadi setuju ya dok ya. Alhamdulillah, terima kasih Dr. Adib setuju untuk
absolutely agree.
Request kepada. So Dr. Adib will forward request to WMA to help help us explaining to the Minister of Health about what you have explained before. Okay, next, any other questions? Because Prof. Sukman able to attend.
Dr. Titi mungkin Dr. Mahmud ada hadir.
Dr. Mahmud, please.
Joko Widiarto.
So, Dr. Otmar, apart from medical association, we also have colleges, like Royal Colleges, Association of disciplines. Yeah, Dr. Mahmud is chairman of Indonesian College of Medicine. Okay, Dr. Mahmud, do you have any comment or questions?
Yeah, Dr. Omar, what should I call you, Dr. Otmar or Dr. Kloiber?
Dr. Otmar.
Just call me Otmar. That
Okay.
everybody does that.
Yeah, all right. Otmar, now, what's the position of the colleges in relation to the chambers of physicians? Are they members of the chambers of physicians? Are they, what do you call that, under bow? Is the
Yeah. In
understand? Yeah.
In my country, as an example.
Yeah.
Do you
So
want me?
yeah, can you explain the position of the colleges in relation to the chambers of physicians? Thank you.
Yes. In my country, we have per specialty 2 organizations. One is what you would call a college, which is more a scientific-based organization dealing with the scientific development of the profession. And the second one is a more interest-based organization, which is dealing for the interest of a specialty, for instance. So for internal medicine, there is one which is a professional association, which is dealing for the interest of the doctors in internal medicine. And then there's also an organization which deals with the scientific aspects of internal medicine. And both of the organizations are independent organizations. They are not part of the chamber. However, whenever there are decisions to be taken which have to do with internal medicine, they are being invited to give their advice, for instance, for the development of postgraduate education or scientific guidelines, which may be necessary as a general rule. And they are being part of an academy which is formed by the German Medical Association, the Bundesärztekammer, the German Federal Chamber, where the academies or the colleges send their representatives to be part of this as a common body. So this is one of the bodies of the association of the chamber, advising the chamber on professional matters, and each of the specialties is represented in this body. But the organizations themselves are completely independent. There is no command line from the chamber to those organizations. They decide themselves what they want to do, whom they elect, whom they send into the academy, and they decide themselves on their matters. However, when it comes then to binding regulations, like for instance, the regulation on specialist education, then the whole body of physicians all decide together. So the canon of specializations and what belongs to a specialty and how is being educated for a specialty is being created under the advice of the college or the scientific association, but is decided by the parliament of all physicians in the chamber, which is a parliament of 250 people which come together once per year and then decide on all of the regulations. So it is a sharing of duties between those organizations and the chamber.
So they are separate, but they are working together, just like a
yes,
horizontal relationship.
Yes, yes. In some countries they are in one organization and they are part of that organization, but in my country they are separate, for instance. But that's one model of organization. Other models are certainly not better or worse.
Okay. In other words,
yeah,
that means that if, like in Indonesia, academy is part of the chamber, that's not anomaly, but it's okay.
Yeah, absolutely. In many countries, that is the way. It is just in Germany that this has been developed separately historically, but that is perfectly okay if they are all under one roof.
It's not, the government shouldn't have to say that you have to do this, you have to do this. No.
No. In many countries, it is under one roof, and both has advantages and disadvantages to some extent. I personally favor this model where everything is under one roof, because you have a much clearer situation then. But in the end, the question is, does everybody understand that they have to work together in order to make a point to the government or to politicians or to society? That is important.
And definitely academy is not under the government.
No.
That's the point. Thank you very much.
Yeah.
Thank you. Because in the new law that is still being discussed, the academy or the Indonesian colleges will be put under the Ministry of Health. So, we need to.
Yeah. Well, that is it would be a very troublesome model, because especially for scientific organizations, I think most of the democracy understand that science has to be free. You cannot have science dictated by a government or directed by a government. That doesn't work. Certainly, governments have their role in providing health the educational infrastructure, like universities and so on. But when it comes to science itself, the science has to be free, teaching has to be free, and either that is guaranteed by free speech, and as in the United States, or it is guaranteed by an own rule in the constitution, like in Germany, that the government cannot influence the teaching.
Yeah.
Okay.
Thank you very much.
Yeah, thank you, Dr. Mahmud. Okay, just 1 minute to explain. Dr. Mahmud tadi menanyakan tentang peran kolegium. Jadi menurut beliau ada beberapa model. Kalau di Jerman kolegium itu terpisah, tetapi ada representasinya di dalam national chamber-nya, di dalam German Medical Association ada representasi. Tapi masing-masing kolegium itu adalah organisasi yang berdiri sendiri. Tapi ada juga model yang kolegiumnya itu adalah bagian dari ada direct command dari Medical Association di tingkat nasional. Okay, next, any other questions? Dr. Zul? Oh, Dr. Carolina. Okay.
Dr. Joko Widiarto. Ya.
Dr. Joko, Dr. Carolina, and then Dr. Joko.
Thank you, Dr. Titi, for the opportunity. Dr. Otmar, I will ask you. You said that public function of the association, one of them is the give the licensing to physician to practice the medicine. In my opinion, before give the licensing, the organization or the association must give the recommendation before give the licensing. My question is, what kind of recommendation usually give by the organization? Is it only the ethic recommendation or also the competency recommendation? So if you give the suggestion or give your opinion to our government in Indonesia, you can say what kind of recommendation must be given by the organization or by association, and cannot give only by the government at all. Thank you.
Okay, Dr. Otmar.
Yeah, for such decisions, for instance, granting a license or giving permission to work in own practice, there are a very standard objective criteria. For instance, if a doctor in Europe has passed the state exam or the board exam, as it's been called in the United States, and if he has not a criminal record and not a mental disease which incapacitates him, then the license has to be given, period. There is no decision otherwise. It's just a formal checking. The same is true for the permission to open your own practice. If the formal criteria are fulfilled, the organization says yes. If they are not fulfilled, the organization has to say no. There is nearly no degree of arbitrary decision-making in that. The standard criteria are very rock solid, and there is not much of a decision-making in between. So that's more or less an automatism if the criteria are fulfilled. There are a few exceptions for foreigners, because for foreigners, it is a state decision whether you give a license or not in most countries. But otherwise, giving the license is a very standard feature. And as I said, in some countries, it's done by the chamber directly. In some countries, it's done by the state, and then you have to be a member of the chamber. So a little bit a split decision there. It is much more complicating when it comes to revoking a license, because there is a lot of decision-making and a lot of expertise necessary whether a physician is still competent to keep a license or not. That can be of professional reasons, that can be of moral reasons, that can be of criminal reasons. And all of this have to go through a procedure, which is usually a court procedure with hearings, with attorneys, a very cumbersome process, but it's not the one process as it is giving a license. Revoking a license is much more difficult.
Okay.
Thank you, Dr. Otmar. So we hope that you can give a suggestion to our government what kind of recommendation. So not all the recommendation given by the government, but must given by the organization, because in my opinion, only the organization, physician organization, know the standard of our profession. Thank you, Dr. Otmar.
Thank you.
Ya, jadi intinya patokannya adalah kemampuan tadi ya, kompetensi. Kalau sudah lulus ujian board atau ujian kompetensi, maka kalau tidak ada mentally ill condition, tidak ada kriminal, tersangkut kriminal, tidak ada alasan untuk tidak memberikan license gitu. Dr. Joko, ya, please. Still mute.
Yeah, thank you very much, Siti. Good evening, everybody. Good evening, Otmar. Indeed, it is a good opportunity for us to have you here this evening. I understand that it's already late night at your country because this. Yes, thank you very much. I have some concern on that, Otmar. Firstly, about the professional ethic. As you know that in this draft of the new regulation, they try to separate the professional ethic from the professional standard. We understand that during the discussion, it was clearly stated that they try to exactly separate the professional ethic from the ethical from the professional standard. While the previous law number 29, it was stated that professional ethic is part of the professional standard. So I like to have your opinion on that because I'm afraid that if someday the professional ethic is separated from the professional standard, then the value of professional ethic become less than less, more. Secondly, about the the strike that you mentioned earlier, you did mention that as long as no one is being harmed, that will be okay. I learned from the WMH statement recently issued during the last year that we have to consider the health service for the community. As long as we can provide those services, that they will be okay also. So are you saying that it is okay we do the strike as long as there is no harm to the community? Thank you very much.
Okay, Dr. Otmar, 2 questions.
Yeah, thank you. I also would argue that it is impossible to separate ethical standards from professional standards in a profession. The professional standards are integral part to an ethical behavior. So I would argue if you are not living up to your professional standards, you are not able to act ethical. You know, there are some moments where professional standards may go back into the background, especially when you come to emotional care, to giving care to dying patients. Then the social interaction, the personal emotional interaction may be much more important than your professionalism as such. But in general, there is a direct link between the ethics and the professionalism. And I would argue behaving ethical without behaving professional is in most cases not possible. So there is a link. When it comes to the strike and not doing harm, we have to be careful. What I said is, if in a strike you harm somebody and you do damage to a patient, for instance, somebody dies, then you have lost. But you cannot say other way around. That would be a non sequitur. You cannot say the other way around. If you do not harm anybody, then the strike is okay. That is not my message.
Okay.
So the strike has to be very carefully planned. It has to be in accordance with the laws of the land. So, for instance, there are certain reasons for which you can strike and other reasons for which you are not allowed to strike. You may be allowed to demonstrate, but you may not be allowed to strike for certain things. For instance, in European countries, you are not allowed to strike for political measures. You can strike for your working conditions and for your salary, but not for general political issues. But you can demonstrate against it, of course. That is something which you can do. So important is that when you do a strike measure, and which may mean not to work in a hospital, then it must be sure that patients who need the care at the moment of the strike are being served. And what the successful unions, trade unions, have always done is to make contracts with the hospitals and saying, next week we will strike in your hospital, and we offer you to have a contract on emergency services. So that the hospitals would know there are doctors which do the emergency surgery, there are doctors which do the pain treatment, and which do every emergency case that is necessary. And I thought first, well, hospitals, why should they make such a contract, you know, being known that they will be striked? And then why should they make a contract? But I tell you, the hospitals ask for that. They want to have it because they have the same problem, that they don't want to be blamed for somebody dying or being harmed by a strike. So there is, if you organize this correctly, there is a good chance of doing a strike and being very careful to your patients. But again, it is different from a company. You know, if you have a steel company and the steel workers go on the street, they don't work, period, end of it. This is very different from a medical strike. And we have to do this with much more fantasy, with much more inspiration, to get the people on our side. And even so, we strike in a hospital, people must say, I support my doctor. You know, this is the aim which you have. And for that, people must be assured, if you need us, we will be there, strike or none.
Clear. Thank you very much.
Thank you. Ya, secara ringkas dari Otmar mengatakan bahwa strike di dalam dunia penanganan kesehatan itu berbeda dengan strike di bidang lain karena berhubungan dengan pelayanan kepada pasien dan jangan sampai mengganggu pelayanan gitu, harus direncanakan secara sangat hati-hati. Next we have Dr. Baharudin, please. Yeah, please, time is yours. If you want to give some questions.
Mute. Masih
You're
mute.
muted, yeah, muted. Dr. Baharudin.
Oke,
Ya.
baik. Makasih Mbak Titi. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Dear Otmar, it is very kind to have you tonight. I have a question about what happened before when we are in COVID. There is what we call medical populism. And as medical populism happen, is there any place for medical association for voicing civil rights and social justice, especially like what happened in COVID time? The second question is, sometimes our colleagues become a minister or become a government official, and sometimes they are in dilemma. They are in dilemma between a doctor and between bureaucrat. In that situation, how, as a medical doctor, as brotherhood, we can do? We cannot even conflict of interest is happen sometimes. Medical association, ethic and profession, I think there is a place for to do something to reduce the collateral damage from abuse of power of our colleague as a doctor, but he or she is a place of government, and I think it is really happened. Medical populism, you know, happened when the COVID time. The third question is about new generation. How in your country or other country, the new generation of doctor see and to be convinced about medical ethics in this volatile, uncertain, and complexity and ambiguous situation like right now, especially in you know, as you mentioned before about globalization, about industrialization of health. We know that in German you have a social insurance compared to other part of the nation. Thank you, Dr. Otmar. Danke, sir.
Yes. May I answer?
Yes, please.
Yes. Well, three questions. First off, the COVID. What is the role in the medical association in COVID? COVID was a health emergency, a very serious health emergency, and I am a strong believer in public health structures. What I think is, in that time, it is very important that the medical associations strictly cooperates and acts with the public health service in order to contain the situation and to mitigate the effects of a pandemic. The association has a very strong role before a pandemic hits, before an emergency hits, by preparing for this, by setting up, for instance, ethical guidelines on triage, for instance, by making standards on supply chains, by giving recommendations on stockage of, for instance, PPE. And the World Medical Association has made a lot of very good guidance. Unfortunately, nobody listened to it before the pandemic. If we had done so, we would have saved a lot of lives during the pandemic, because we gave some advice which would have helped to mitigate the pandemic much better. But the lead in a pandemic has to be taken by the public health service and the public health institutions in order to get a containment of an epidemic and to avoid a pandemic, or if a pandemic is there, to deal with the pandemic and to save the population as a whole. And there I see our service is to serve the public health service in order to get over this problem. Second question about doctors becoming a minister. Now, when you become a physician, you usually make a pledge on how to treat your patients and on your behavior. The Declaration of Geneva is such a pledge. When you become a minister, you have to swear on the constitution of your country. And you have to swear to serve the whole population. And yes, this produces very often conflicts between one and the other aim. And a number of my friends have become ministers of health, and they were in this dilemma of one side being a physician and having a very clear idea about them and their patients, and on the other hand, of being a person running a healthcare system and a state and a public health system. So on one side, we have to be patient with them, understanding that they have these different loyalties, or these dual loyalties, which they then have to take care. On the other hand, we should remind them from time to time of their role as physicians and of their knowledge as physicians, and not to subordinate everything to a party or a political stream in their country. So it is a very difficult one, and it's not always a pleasant one. I absolutely know. Number 3 is the question of ethics and the young folks. Now, in most countries now, you have ethics education when it comes to that. But I am personally convinced the best ethics education is if we, the older generation, give a living example to them. And I think our behavior is key for what they will do in the future. How we treat them, how we treat patients, how we treat society is the key for their learning and their behavior. And I think that's even much more important than any ethics education you can do. And if chief doctors and seniors behave badly, you must expect that your juniors go the same route. So it is up to us to give an example and to lead by example, and to demonstrate ethics behavior and to discuss with them. Because many problems are difficult to understand and many dilemmas are not solvable. And that is also a lesson that people have to learn, that you have to live sometimes with uncertainty and with a problem that the best solution cannot be found. But it's up to us to be the example. Thank you.
Mbak
Okay,
Titi, boleh saya lanjutkan, Mbak Titi? Dr.
boleh. Yes.
The first question is about medical populism. Medical populism is the term for how the government, especially lead in the emergency situation. And we know it happened when the medical populism is something make not easy, because people are become enemy to others. Now, in that situation, what do you think about the medical association? Should the medical association only silent or say something to be civil right? Medical populism is ruin all our way in ethic, in professional, and flip learning. Please,
Yes.
Dr. Otmar.
Yes, I absolutely agree. The medical association has a role there. And here comes when ethics and professionalism come together. It is our role to educate the population, but also to monitor the government, to stay with the evidence, to stay with clear fact-based information, even so if that may be difficult.
Yes.
But there is no, especially in a pandemic, there is no room for populism. That is something where we have to be strict. And what I argue for is that we as associations also make sure that our public health services can be acting on evidence, on science, and not on political trends. That is something which we have seen. I mean, you have seen the big case of the United States, where you have had a president at that time who had very crazy ideas. I think at that time you also had a minister of health who had some crazy ideas in your country. And of course, at that point, it is the obligation, the ethical obligation of a medical association to speak up and to stay with the facts and to explain the facts to the people, and not to be swept away by populism. That is absolutely dangerous and is killing a lot of people.
Danke, sir. Danke, sir.
Okay. Thank you. Just to translate, jadi pesannya sangat jelas bahwa dari etik pendidikan etik tadi yang terpenting adalah contoh, role model, teladan dari yang senior untuk yang junior. Kemudian justru dalam kondisi sekarang ini penting sekali peran OP untuk mengingatkan pemerintah, ya, supaya tidak membuat keputusan berdasarkan politik, tapi betul-betul berdasarkan evidence-based science. Jadi ini ethical obligation, ya, kewajiban etik kita semua untuk melakukan ini. Any other questions? Otmar, previously, you have 1.5 hours for us. Is it possible to extend some more minutes if there are still any questions?
Mbak Titi, boleh sedikit saya tambahkan, Mbak Titi?
Oke, ya.
Jadi begini, teman sejawat sekalian, kejadian pada waktu COVID itu dibuat terminasinya adalah medical population. Dan medical population itu one upon a time terjadi di negeri kita. Bukan hanya di Amerika Serikat, bukan hanya di Filipina, terjadi di negeri kita. Kita bukan bagian untuk menyalahkan, tetapi untuk mempelajari. Medical population itu merusak. Karena dia tidak mempunyai evidence, dia mempertentangkan, dan dia tidak meletakkan semua pada tempatnya. Dia melakukan kegiatan-kegiatan yang disebut dengan ad hoc, padahal structure dan person itu ada yang bertanggung jawab. Dan itu terjadi di negeri kita. Jadi saya senang sekali bahwa Dr. Otmar menjelaskan kepada kita, itu adalah tugas Medical Association untuk berdiri tegak mengingatkan bahwa population tidak ada tempatnya di dalam penanganan bencana. Terima kasih, Mbak Titi.
Yeah. Okay, Dr. Otmar still provides his valuable time for us. If there are still questions, burning questions. Any more questions? Dr. Jul Asdi.
Ya, mungkin dari Mbak Adip, kalau tidak kita tutup.
Oke.
Boleh Mbak Titi kalau diinginkan. Boleh. Dr. Otmar, I want to ask you your opinion about what happened in German right now. Social insurance for universal health coverage. I learned how German is not easy for Germany to do the social insurance for health insurance, but also you have to protect your all and some people from other part of nation. Germany is the harbor of refugees. I want to ask you how the Germany government take care not only for the Germany, for the student from many part of the country, but for refugees. Where's the financing come? Is there any way to make it happen by the law, by regulation, and is there any fund to do that? Sorry if it's not clear what I
No,
want.
it's clear. It is clear, if I may immediately answer. It is indeed a big burden. And in Germany, usually people who have no income and who are not insured through their work situation, which is the normal way in Germany, that you and your family are insured when you have an occupation, and then you pay part of your salary from the employer and the employee into the sick fund, the health insurance. If you are not employed and you are living on social security, then the municipality in which you live has to pay for your health insurance. Now, refugees are being put into municipalities, and the municipalities are in charge of paying also the health insurance for you, so that the people are being covered. At least after some time, and until then, they have to pay directly for the health insurance. And this is a real severe burden to the municipalities in Germany. The municipalities in Germany are suffering from that. They get some subsidies from the state, from the federal government, but that is currently not enough. So it is producing a big problem for municipalities, and municipalities in Germany have stopped providing luxury services, like, for instance, having 2 swimming pools for the public instead of 1. And so they have cut away from all the things they could cut away in order to be able to pay for those services. But right now, everybody is covered. So people who come as refugees get the health care in Germany, and that is not being contested by anybody.
Yes, Dr. Otmar, can I ask you about how in Germany the doctor support? If I am in specialist or in funds, how I support by the government, or I support by the hospital where I am working, or there is a law regulation to support me and my family, because I need to marry, to have children, and the children need to have school and everything about that.
Yes. When you have finished medical school and you get your basic license as a physician, you apply for a job in a hospital which is allowed to give you specialist education. And during that time, you already get a regular salary.
Okay.
So comparable to, for instance, a lawyer, which after law school and bar exam goes into the public administration, you get a similar salary, which allows you to have a family, to rent a flat, to buy a house. It's not a high salary, but it is good enough to support you. Once you are a specialist, either for some of specialties or for general practice, then you either stay in the hospital as employee and you will get a higher salary, or you open your own office. And when you have your own office, you need to have a contract with the health insurances. And if you have a contract with the health insurances, then you are remunerated by the number of patients which come to you and the services you provide.
Okay.
And usually for Germany, making a living as a physician is not a luxury, but it is also not difficult. So you can be sure you get a job, you can be sure it is correctly paid. For young doctors, I would say it is really not too high. It could be better, but it is at least comparable to other professions, although doctors usually work more than, for instance, lawyers or economists or others in similar starting positions. But there is an income for every physician, no doubt.
Yes, so thank you very much for telling us how Germany valuing the doctor in that country to support the health of the people. Thank you very much. So, Otmar.
Okay, thank you.
Dr. Titi,
Next,
Pak
yeah,
Priyo.
Dr. Priyo.
Yeah.
You raise your hand.
Yes, Otmar, just small question. As you already serve as a Secretary General of WMA many years, so I think you have a lot of experience. I want to know how much the budget, national budget for healthcare in average country. Let's say, if I'm not mistaken, in Africa, Ethiopia now is getting better because the national budget of healthcare become increasing, because they have also in Africa what's so-called Declaration of Abuja, that 15% of national budget from the national health care budget from the national health from the national budget. So do you have any reference? Because in Indonesia so far is 5%, and during this draft of the new regulation, it will be raised. Thank you, Otmar, for giving me information.
Okay, Otmar, it's our last question. Yeah.
Yeah, this is a little bit a difficult question because many countries don't pay healthcare through the national budget. For instance, in Germany, nearly nothing is being paid out from the national budget. That's a small amount of number. Everything is paid through the sick funds, which are completely independent from the government. Although there are public institutions, but they are independent from the government, and the money never goes through a public budget. It doesn't go through a state budget nor a federal budget. It goes directly into the health insurance. So for me, more important is to look how much is the percentage of the gross domestic product. And to that extent, the successful, very successful healthcare systems are between 6, which is a very low one for Japan, for instance, and 14 or 15%, which is in the United States, a very high one. In Europe, most of them are between 9 and 11% of the gross domestic product. And that is, of course, much, much more than 15% of a government budget. So even 15% of a government budget seems to be high. It is not very much. You need to come up to something like 8, 10, 11% of a net gross domestic product. Maybe in the Asian countries, which are more disciplined than the European countries, it may be a little bit lower, like in Japan or Korea. I think it's also lower. But if you really want to have a solid healthcare system, you need to look for something like 10% of your gross domestic product and not 15% only of your government budget.
Thank you, Otmar. Thank you.
Okay, thank you. I think Dr. Otmar already extended 20 minutes of your time. We will come to the conclusions. Please allow me to summarize just a few action points. Jadi, Dr. Otmar menawarkan WMA bisa membantu kita berdasarkan request dari PBID, dan ini kesempatan untuk memberitahu secara langsung, memberikan informasi secara langsung kepada Kementerian Kesehatan, ya, terutama Menteri Kesehatan dan timnya. Tadi beliau mengatakan bahwa Menteri Kesehatan mendapatkan advice yang kurang tepat, gitu ya, tentang beberapa isu yang sebetulnya hal itu sudah baik kita lakukan selama ini berdasarkan undang-undang praktek kedokteran, tapi malah dirubah menjadi ke arah yang tidak jelas, yang akan menimbulkan ketidakpastian, akan menimbulkan insecurity, dan dalam jangka panjang bisa menimbulkan damage, ya, kerusakan. Dan ini kewajiban kita, ethical obligation, kewajiban moral kita, etik kita sebagai organisasi profesi untuk mencoba meluruskan itu. Baik. Once again, thank you very much, Otmar. Dr. Jul Asdi will give some closing remark.
Ya. Terima kasih, Dr. Titi. Thank you for the rare and very great presentation, Dr. Otmar, in this discussion tonight. We really hope for a statement for Dr. Otmar regarding tonight discussion for me, for us, to give for the Indonesian government. Thank you very much, Dr. Otmar.
Ya.
Masih ada Dr. Adib Kumaidi untuk closing statement, Ketua Umum PBID. Oh, tidak.
Ya,
Terima
maybe
kasih,
Dr. Otmar
sejawat senior guru besar.
closing statement.
Oh, apa kita perlu berfoto, Dr. Titi?
Foto?
Itu.
Okay. Ya, take picture.
Tapi saya tidak bisa melakukan. Atau Dr. Otmar mau closing statement, silakan.
Ya, Dr. Otmar, could you give some closing statement, some based on your long experience, your wisdom, what we should do in these situations in order to improve the situation. Thank you.
Thank you, Titi. First of all, thank you for inviting me. And I wholeheartedly share your idea that it is worthwhile to fight for the unity in the country, to have the Indonesian Medical Association staying there as a strong partner for government, for the society, and for patients. And that is something worthwhile to fight for. If the World Medical Association can help you by giving statements, by intervening on your behalf and on your request to your government, we are very happy to do so. Please don't hesitate to ask us. Please don't hesitate to call us. We certainly will do so, either with technology or with personal presence. I think it is very important that we keep strong structures and let not politicians split us up just for having a very populistic move and maybe a short-term political benefit for them. But it is not good for the population. It's not good for health. So let's stay fighting for it. Thank you very much. And again, thank you for inviting me.
Okay, thank you.
Thank you, Dr. Otmar.
Terima kasih semuanya. Thank Dr. Otmar.
Yeah. Oke, sejawat senior guru besar, itulah hasil diskusi Forkom malam hari ini. Terima kasih kepada moderator dan penanggap. Dan mudah-mudahan kita bertemu dalam forum diskusi berikutnya. Maaf salah dan khilaf. Ya, tutup. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. So we certainly will contact you again, Dr. Otmar. Thank you. Thank you. Bye-bye.
Thank you very much, Otmar.
Next moderator, Kang
Dr.
Hadi
Titi.
Wijaya.